an eminent gynae and surgical oncologist actually in Mansoura. He's a dynamic person, moved the Egyptian Gynae Oncology Society forward with his lots of activities and connections all over Egypt. So he's talking to us about the situation of the gynae oncology in Egypt and the challenges in a diplomatic way he promised me.
Not very diplomatic one. أنا قلعت علشان أجهز. So it's nice that most of the floor are Egyptians. It's very nice because I'm going to speak some words in Arabic, and I'm going to speak specific words in Arabic, so that Raj would understand what we are saying. But really, I'll try to be as diplomatic as much as I can, because today I'm here. I believe in this. This is my belief is that education is the most powerful weapon which you can use to change the world. This is my dictum in life. And I'm here today in like peaks of frustration and depression and peaks of optimism and enthusiasm. I'm very happy. So you will find a bipolar presentation between happiness and hope and between depression. The first of all, that conflict of interest, that I'm a surgical oncologist. And some here in the floor or in the field feel that you are an intruder. You shouldn't work in gynecology. What you are doing, you are an oncosurgeon. You should go and work other surgeries rather than gynae. You shouldn't go. Or I'm just, others believe, or the majority, the vast majority believe that we are complementary to each other and that we have to complete each other. They are the vast majority and they are the people who give us hope. So, do you know what's the meaning of diehardism? Do you know what's diehardism here? Diehardism is when someone is stubborn and sticking to outdated, out-validated data, and he wants to stay on the history with no changes. The world has changed, there is new requirements, there is new things that's happening, but he still believes this is something, this is what I learned in the faculty, this is what is stated, and then this simply you die because of your hard thinking. You shouldn't hard thinking, you should be malleable. So this is, just Google it and see what's diehardism. So if you believe that everything is perfect, or what we say, dunya zay al-ful, or if you believe that gynaecology status in Egypt is perfect, or as someone who said for me that gynaecology is very well established before you were born already, كل حاجة كانت كويسة جدا من قبل ما البشري يتولد أصلا. So please don't stay because you wouldn't like what you will see in the room right now. If you feel there is a problem, we will see. Who is a gynecologist? Simply, he is a physician who specialized in diagnosing and treating cancers that are located in women's reproductive organs. He should have completed obstetric and gynecological residency. Here it is. He should be an OB-GYN. So please go out, Basil. You haven't done that. Then pursued subspecialty training through a gynecological oncology fellowship. This is the completion of definition of gynecologist, not a general gynecologist, not a general OB-GYN. He must have had pursued subspecialty training through gynecology fellowship, like exactly what Dr. Sekturi has done and passed through. So this is the definition. If I had got the first part, this is like what we call ولا تقربوا الصلاة. خدت ولا تقربوا الصلاة لازم يبقى بتاع نساء وتوليد. لا, he should have completed this fellowship. In this fellowship, he involves 3 to 4 additional years of intensive training about surgical, comprehensive radiation, research technique, chemotherapy, radiotherapy, target therapy, everything. And this who completes this, he is eligible to take the obstetric and gynecology board exam and then be a gynecological oncologist. And this is simply what we do as surgical oncologists. We have the fellowship and we have all the experience in chemotherapy, radiotherapy, excentrations, surgeries, all of what we do as surgical oncologists. And then we passed through the exam of the ESGO, and we passed, I was the first one who passed the ESGO exam, and we are 2 all over Egypt. The 2 are surgical oncologists, and I am certified from the ESGO to work as gynecologist. So simply, we complete each other. We complete each other. Yes, I already have the ESGO exam. So yes, I passed it in Athens. It's the first time, and I was the first one who finished the exam. So we will complete discussion after that. No, I was the first one who finished, not the highest score. But then Vergotti told me either the exam is very difficult or it is very easy because you finished 3 hours in 1 hour. But I passed getting 80%. So the gynecologist wouldn't work alone. He is a captain of a team. This team, it's important to go through this team, which is the patient-centered, not the surgeon-centered. And then we have the core team, which is the surgeon or the gynecologist, whatever, the radio, the oncologist, the internist, the nurse, the pathologist, and others like psychologist and palliative care and nuclear medicine. It's all a team. So even if I'm the best ever surgical oncologist, if I'm the best gynecologist, I don't have the team, I'm not going to provide service. I have to work on the team, on this circle. I haven't to work alone and to exclude others just to be the best. I do the best surgery. Then my patient wouldn't have chemotherapy, wouldn't have target therapy, wouldn't be radiologically diagnosed, wouldn't be pathologically diagnosed. diagnosed. So simply, this is a failure for me and for my work or for the whole service. I should work on the team that. Do we have a problem in Egypt? I'm very happy that Dr. Reda stated we are in deep shit in Egypt. We have lack of well-constructed gynecological cancer subspecialty in the region. Up till this now, there is no official training program in gynaecology all over Egypt, which are 100 million population, but it's changing right now. There is no training program, there is curricula, there is no fellowships, there is no diplomas officially up till this moment. There is very few centers and units. None of them were accredited, just but this changed because we have now accredited centers. There is shortage of gynecologists who can deal with upper abdominal disease, and the oncosurgeons work without a gynecological background. Just they consider ascites stage 4, for example, ovarian cancer ascites stage 4, this is advanced. Or why wouldn't we do surgery for all advanced cases of cervical cancer, for example? Why to give chemoradiotherapy? We should do that. Yes, I'm going to speak about that. And then, like I was giving some lectures for the Egyptian Fellowship of Surgical Oncology last week about cervical cancer and endometrial cancer. I asked them a case of stage 3 cervical cancer, what you are going to do. Some said upfront surgery, some said neoadjuvant radiotherapy followed by surgery. They said everything except for concomitant radiotherapy. And even some consultants of oncosurgery believe that we give chemotherapy as a neoadjuvant, chemoradiotherapy as a neoadjuvant for cervical cancer. So we are not going to the guidelines. There is not enough radiotherapy machines. We have to sit together. I did the best surgery, but I don't have external beam, enough machines for the population, and the brachytherapy is very limited. Just in Alexandria, Al-Asr Al-Aini, in Munufiyya, but it's increasing. Everything is being resolved. The brachytherapy, I'm speaking about the brachytherapy. Yes, that's what I'm going to speak right now, but already in Mansoura, for example, we have a long waiting list for the external beam radiotherapy, so we have to send our patient to Kafr Sheikh or SOAS. This is very easy to us as doctors, but for the patient itself, or if a poor patient who is old, they go to have the radiotherapy in Tanta. Dr. Reda, I believe, agrees that we have a very long waiting list because they treat all that. So really, we still, but there is new radiotherapy machine in our university everywhere, but there is package here. It is enough all over the whole population, but people have to travel to go through. Even in Asr Al-Aini, you know, the machine is working sometimes and not working sometimes, like that. And there is no official screening programs. There are some initiatives from Mansoura, from Alexandria about screening, but there is no screening programs. And we have enormous expense for genetic studies. All the people are speaking about the molecular classification of endometrial cancer. You should do the pool mutation, you should do the NGS. The money, and then whenever I do the test, how the patient is going to receive the target and the immune therapy and everything if it is not covered by insurance. So, simply, for those who don't know, this is our curriculum of MD in surgical oncology. Gynaecology is a part officially in the curriculum, so that's our curriculum. And this is the fellowship, the Egyptian fellowship, and gynaecology is a part of the curriculum of surgical oncology. So simply, this is what we have studied. Simply, my MD thesis was about ovarian cancer lymphadenectomy, and I did it in National Cancer Center in Tokyo, in Japan. So I'm not speaking about something that I just interested in or just I practice, and then this is my MD thesis. This is what the country gave me and sent me on the expense of the country, and 6 or 7 of my colleagues outside send and expense thousands of dollars to learn them. So I shouldn't go right now and say, please stop and work anything, but not what you have been going to Italy, to Gemelli. We have fellowships in Gemelli, in Strasbourg with Sherif Akladios. Then when he come back, no, you are a surgical oncologist, you shouldn't work. And all the money spent with Sherif Akladios and all the money spent with this Scambia and Fagotti. No, I don't know. Students are in the OB-GYN department, so you shouldn't work about that. This is what I call about the art of losing, the art of failure. The failure is an art too. So this is the problem when we are fighting together. We believe that we are this picture on the other side, but really we are like those. If we are fighting, we are like those kids. It's kids. It's a very poor fight. Because now we have economic crisis. We are losing everything. A real economic crisis all over the world and Egypt. It's official that we are in economic crisis. We should go for that. And we have the other problems that doctors leak. We prepare the doctors, we have very good education, and then the best of the best and the best ever are leaking. So please, if you have someone who is working, don't push him to leak. Simply, if you are going to push over me, why I'm going to stay in Egypt? Why? I'm going to go to Saudi. You are going to lose me. And I not speak about Basil, about Osama, about Ashraf. If you are going to lose those few doctors who are really working who are carrying the responsibility of this cancer service, you are losing. Because انت بتبص لمصلحتك الشخصيه وطز في البلد. الكويس ده يمشي ونقرفه لحد ما يمشي. We have a real problem of doctors leave. This is simply.
In your presentation, you're putting the way forward?
Yes, don't, this is the first part. So simply, احنا بنتخانق على ايه؟ This is very Egyptian. مش خناقه. بتتخانقوا على ايه؟ يعني انا اسف اللي بتتخانق على عظمه يعني this is خناقه. So we started to go. I went to someone and said, we have to speak the same language. We don't understand each other. And then he told me, no. He was the head of one of the OB-GYN departments. We shouldn't speak the same language. We should do discrimination. So just Google discrimination. Discrimination is very bad. We should all fight discrimination. Discrimination is racism. We shouldn't do discrimination. We should speak the same language. So it's a fight of speaking the same language versus discrimination and division. It challenges. What I have heard, I call this travel. This is hayafat. الحاجات اللي بنسمعها. Discrimination. You are not qualified to train. I hear that, but I'm qualified, I believe. The accreditation was virtual. You deceived the ESGO. The ESGO gave you a false accreditation. And this is very funny because we have more and more cooperation with ESGO beyond the imagination of anyone. You should work only advanced, metastatic, and recurrent, but we should work the early. How? If you find a lymph node in ovarian cancer, I should stop you. This is stage 3. Don't work if you explore and find peritoneal dual. No, you are OB-GYN. You should send for me. Simply, how can I differentiate? And simply, how I'm going to, you want me to do excentrations and do the recurrent metastatic without knowing to do early? How I'm going to do a lateral extended resection if I don't know how to do hysterectomy? I should work early. I should work everything to do the advanced if you want me to do. And I can't stop you from doing the advanced. I can never, ever say to you, no, you don't work the advanced. So if I'm doing it in the right way, please don't stop me. And simply, this is nonsense. Nonsense. How you are going to define advanced and recurrent without exploration is what everything. And then I have a phone call from someone who's very friend of mine. Basil, you should stop speaking about screening, vaccination, and fertility sparing. This is not your work. This is the work of OB-GYN. We speak about screening in breast cancer. I find the cases. I find many cases. You are oncosurgeons. Dr. Reda said that we see more and more cases of cervical cancer advanced because no screening and vaccination. Even if I'm an engineer, even if I'm a football player, I can speak about screening and vaccination. This is a must to raise awareness. And I'm very proud that I have vaccinated myself and I'm oncosurgeon more than 2,000 women in Mansoura up till now. They all know that. And then one of the professors go to the health authorities, you should punish Basil. He is vaccinating girls because there is no vaccine in Mansoura in official. So this important man called me, Basil, you vaccinate the girls? I said, yes. He said, I'm going to send my girls for you to vaccinate, please. This was simple. It's simple. All of this was very funny. So, for example, in Asyut and in Ain Shams University, we have a gynecological cancer screening and early detection unit. This is a unit and a gynecological cancer unit. So simply, these are two issues. So if I'm doing a screening and early detection, it's a great work. This is really what we believe, what we encourage. But this doesn't mean that others can speak about this. And again, if you are in the gynecological cancer screening unit, I can't prevent you from doing the gynecological cancer unit. So if you want discrimination really, I leave you this screening. Yes, go and do all the screening, but leave all what's related to surgeries for me, and I'm not with that. Do whatever you do in the right way. So if you want discrimination, I can do discrimination, and it's officially present in Egypt, in Ain Shams at the Asyut. But this is not a good play. Real, true challenge. The settings in Egypt are difficult. This is psychological overload of doing cancers. This is psychological. Really, OB-GYN, you have some obstetrics, you have babies, you have balloons, but this is psychologically overload. We have difficult surgeries, morbidity and mortality, and we go to the court. I have been to the court in Mansoura and to Cairo 1 or 2 times. Legalizations and problems. So it is not something to go. This is difficult surgeries, really. The situation in Egypt, we have many units now. We have in Cairo, of course, the largest, the NCI, which is the NCI, and the Ain Shams University Gynaecology Unit. In Mansoura, we have the Mansoura Center Oncology University, and we have the Gynaecology Unit too in the OB-GYN department. And we have in Alexandria, very good Gynaecology Unit, and in Asyut too, we have the Gynaecology Unit and the upper ear. So we have several. And Sohag, we have centers in Biatta and Tanta, cancer centers. But I'm speaking about those who are dedicated to gynaecology. But we have centers in Dmiatta, in Tanta, in Kafr Sheikh, and Luqsor, Shifa, Al-Orman. But for the gynaecology service, the large scale of gynaecology service, NCI, Ain Shams, Iskandria, Mansoura, Asyut, and of course all the other centers. Two of the centers now, as the Ghazik Dr. Ashraf, this is the Ghazik, Dr. Ashraf Nasr and his group. So we have 2 accredited centers now in Egypt from ESGO. So the problem, Dr. Ahmed, as you said, is now being solved. We didn't have centers. No, we have centers. We have people who are interested. Yes, we have. And we have 2 centers who are accredited. One of them is in Alexandria. That was the second one accreditation. And the first was Oncology Center, which was a false accreditation. We deceived the ESGO about that. Really what we are doing, let's go to the good part, or the green ways that Dr. Reda speak about. We have the BGICC. We are still here, the biggest conference of breast and gynae. But still gynae is a small part. We are in the smallest hall in the conference. We have the Egyptian Gynaecological Society and the Go Egypt, which is dedicated to gynae oncology. We have relations regionally with the PARS Go by Jalid Suhouli in Charité. He created the Pan-Arabian Research Society of Gynaecological. We have very good relations with them. And we have very good relations with the Middle East and the Mediterranean group of gynae oncology, the Turkish group, and David Atallah from the IGCS, Muhyiddin Sayoud, Nadima Brostom is working with them, and people from Emirates, Saudi. So we have a very good connections with them. And then we went internationally to have relations with the ESGO. We have ESGO Accredited Center. We have many things doing with the ESGO, and we have more and more beautiful news for all Egypt and the region with ESGO. And the IGCS, I am one of the panel of Africa for the IGCS group for education. Yes?
Do you have a college of obstetrics and a college of surgery?
Of course. College? Mm. لا لا لا. No, this is my last slide, Dr. Ahmed. This is my last slide. We finally finished this hesitation. So we have regional in Saudi Arabia with PARSCO. We have Sabima Go in Tunisia last October. And we have all the relations with ESGO. There's Nicole Constantine, Philip Maurice. They were in Berlin, and now they are in Cairo with you. And Philip Maurice was in Tunisia with us, and now he is in Cairo. So those are the yeah. How to improve? What's the solutions? Is it conferences? Yes, conferences where we meet all together and discuss and see all of that, like the BGICC. Again, for the educational meeting, which I like so much, we have the Go. The first Go was in 2017, second Go in 2018, third Go 2019, fourth Go Egypt was in 2020 with the launching of Egyptian Gynaecological Society. In fifth Go, that was the first Egyptian Gynaecological Society meeting, and sixth Go just a few months ago was the sixth and second EGOS meeting. So it has been yearly since 6 years up till now. This is the sixth Go with the Scambia. You were just people, Scambia and Fagotti and Nicolo Bizari, and they were all in Cairo just a few months ago, and they visited the pyramids. And we are going to have the seventh Go with the Mima Go in December. So this is the seventh Go. That slide was in Tunisia, that we are going to have the seventh Go in December. So we welcome all of you in 7th and 8th December. We will finish it early as much as we can. Workshops, do we have? Imaging workshops? Yes, it has been done. Laparoscopy workshops? Yes, it has been done. Pathology workshops, gynae pathology, and we are speaking about gynae imaging and gynae pathology workshop, yes, in December 2021. In Mansoura only, no. In Luxor, with Dr. Amr Kamal, it was in collaboration with EGOS. In Asyut, Dr. Hisham Abu Talib is very active in that, and we had 2 scientific days, one last year and just one last week with Asyut about cervical cancer screening, so this is from Asyut. In Alexandria, with the radiation therapy and brachytherapy hands-on workshop with Dr. Niamat Higazi, and a genetic course that was one of our peaks with AstraZeneca and with GoSor in UK. If you know GoSor and Faiza Gaba from UK, we have a very good course for 20 doctors about genetic counseling, and they all received their certificates just a few days ago. We had the endometrial cancer masterclass with the ESCO last year in March. That was the ESCO with EGOS. And we had the lymphadenectomy hands-on masterclass that was live transmission from the OR, from Oncology Center, Mansoura University, for open and laparoscopic surgeries of lymphadenectomy, covering all lymphadenectomy aspects. And it was the first time in Egypt to have a sentinel lymph node using the ICG technique, live transmission from the OR. I was down in the theater, but my colleague Khalid Gaballa was doing the sentinel in the OR. I'm just doing that. And next May, we invite all of you to go to the multi-organ resection. We are going to get the liver, the splenectomy, the protonectomy, the diaphragm, every organ alone for the multi-organ resection advanced ovarian cancer workshop. It will be at 2 days where we'll dissect everything just in May. Is it about? No. I believe in continuous medical education. So we have 2 fellows from ESGO. Every Wednesday at 9 o'clock, just open the Zoom or go online through the website. You will find a hybrid, physical and online. In March, we started introductions, this the program of March. In April, we started the ovarian cancer curriculum for more than 2 or 3 months, April, July, May, June, August, and then the endometrial cancer, we finished in September, October, November, December, every Wednesday at night, 50 lecture till now, and then January, last Wednesday was Fatma Farouk speaking about treatment of locally advanced cervical cancer. And next Wednesday, Dr. Hussein El-Haj from Korea, from Paris, is going to speak about role of surgery in advanced and recurrent cervical cancer, just like Raj Naik. And this is February schedule. It's already done with vulval. We finished the cervical cancer, and we will have the vulval cancer about epidemiology, surgery, chemotherapy, and then reconstructive plastic surgery basics next month in February. So all these presentations are found recorded in our website, egosegypt.com. You'll find all the lectures recorded, PDF and recorded. So this is our educational resource, this is our website. You can go all activities to find it. And all the presentations you can find posted in PDF and recorded for everyone. And we will update every year, I hope so, if I completed that. We have the tumor boards with the Parsigo, the IGCS, this is what we work with, the IGCS Parsigo tumor boards. So every month we have an online tumor board. Today at 3:30, we have our tumor board, and I have 3 cases, but I'm not be able to that because I'll be the BGICC ESGO meeting. But my fellow Walid will present 3 cases, and Dr. Reda will present 2 cases in the tumor board today, virtually online, with Jalid, with Robert Coleman, with all of that in the tumor board with us. So guidelines, we had a national group of OB/GYN professors who are preparing guidelines in everything related to OB/GYN. I believe there is a project that we were excluded from because we are oncosurgeons. But as we were excluded from that, simply the ESGO started to do guidelines for limited resources setting, and they do a group. I have just received the mail of confirmation 2 days ago from David Shebula to be the champion of the region to go through the guidelines, this low resources setting. So if you are excluded from something, just simply you are going for another thing with the ESGO guidelines. We are going to publish the cervical cancer in Istanbul, and we are going to publish the endometrial cancer in Barcelona in 2024. So this is great. This is the hope. This is what we are doing. We have published 2 papers, one from Asyut and one from Mansoura, about the experience in the International Journal of Gynaecological Cancers in the corners of the world. This is from Upper Egypt and this from Lower Egypt. And we have the accreditation, the true accreditation, and the real one who is working right now. I believe people from Alexandria are here, and they can tell them by themselves that the only working program now is from Mansoura. We have the fellow from Palestine and the other fellow from Bani Suwaif. So this is a certificate of accreditation for the surgical oncology unit. It is not accreditation for the center, for the surgical oncology unit. They know we are oncosurgeon, and the true accreditation, it is not a false accreditation like some people claim. Okay? And when those people say this is a false accreditation and we have to stop that, this is the good news, Dr. Ahmed. Now we have the approval, Dr. Gamal Amira is here. We have the approval of doing an official governmental clinical fellowship program in gynaecological cancer surgeries, okay, which will be held mainly in the National Cancer Institute, in Oncology Center, Mansoura University, and Mahad Nasser Institute. And the people who are eligible, simply what we believe, and we say, MD of OB/GYN or MD of surgical oncology, or fellowship of OB/GYN or fellowship of surgical oncology, he is welcome to come. So if someone stops some people from coming, they will come through the official. We had a narrow way to train people. People just want to close it. So we have the big one. This is the fellowship officially that we work everywhere, and we are going to announce this week about that. This is the first announcement about this fellowship. So it's going to start officially, governmentally, fellowship, and the training will be officially in our center about that. So if you finish the fellowship, yes, the one fellowship across the country, once you finish the 3 years of OB/GYN or surgical oncology, you can go to 2 years fellowship of gynecological cancer surgery. Or if you have MD OB/GYN or MD surgical oncology, you can go for 2 years fellowship. So simply never lose hope, Dr. Ahmed. Things can change and are changing in a marvelous way. Don't let anything stop you. There will be times when you will be disappointed, but you can't stop. Make yourself the best you can, make out the best, and together we can achieve more after excluding those who want to break all the bonds. And thank you.
Okay, okay. I'm not neutral. I one of the best gynaecology surgeons I've ever met was a guy called Eric LeBlanc. He's French, trained by Denis Calou and Daniel Darjon. He trained from surgery and then went to gynae. So this is not new. In Europe, this happens regularly, where surgeons can either go to surgical oncology or gynaecology. You know, they have to, of course, develop their expertise, but then they get accepted. And Eric LeBlanc gets invited all over the world. So, in principle, there's nothing wrong in this at all. In the UK, there have been lots of arguments for many, many years, arguing that gynaecology should not be in obs and gynae. It should be in the Royal College of Surgeons. Now, there are arguments for, arguments against.
My contract at the Christie actually was surgeon, not gynecologist.
Yeah.
And I belong to the Department of Surgery at the Christie.
Yeah, exactly.
No department of
You know that
gynecology.
when they have the UK example in our school, that's why they try to put the program, but then simply if they go to France, they will transfer over to UK. So you just do what's best for you. Don't take, don't supplement, take one example. Like
Yeah,
UK.
correct. Yeah. So, you know, because obs and gynae don't understand gynaecology. Take my word for it. In the UK or elsewhere. Surgeons do, right? But there is more to gynaecology than just surgery, which you've demonstrated in your presentation very, very well, and what we've heard from all the excellent presentations in this conference today and yesterday. And which is why I asked the question about the Royal College of, the College of Obs and Gynae or College of Surgeons. The next point is, never be embarrassed about being called a troublemaker. I take it as a compliment. Yeah. I've been called a troublemaker for many, many years. It's a compliment. All right? If you're not causing trouble, you're not doing your job properly. So I don't have the answers for what's right in Egypt. One thing's for sure, things are not perfect in the UK either. So I agree with you, the diehards who believe it is perfect, maybe, you know, they need to a little bit and let other people talk. So I will shut up and let other people talk.
Okay, I'll give this to, introduce yourself, please, sir.
Yeah, Magdi Noor from the University of Colorado. Very nice presentation. But from knowing the system in Egypt, first of all, the system has to be revamped. And the board is one of the steps. The Egyptian board is one of the steps. Second, you have to standardize the training. You understand me? And then divide specialty, subspecialty, and then even you go to get the training outside, you come here and they equalize it to, if you do gyne-onc outside, they come equalize it to gyne-onc. You understand? And the third, very important one, privileges. Clinical privilege. You cannot just practice without clinical privilege. In the States, you can't. You understand? So it's not only doing a course of laparoscopic pelvic lymph node dissection and doing the surgery. No,
Absolutely.
you have to be monitored.
This is essential.
Clinical privilege is very important in every hospital in Egypt.
But we do the clinical program and we said both the two who are training on the planet from Egypt are probably surgeons. And we just want to don't train them. Let them be trained and then stop us. So it's very strange that we are training as oncosurgeons, we are training OB-GYN, we are open. You know, the whole problem now is that they want us not to train OB-GYN, train only oncosurgeons. This is good for us. If I'm looking just blue by, this is good for us. But really, this is what I'm very astonished. We said, I have some training, I'll give you, it is ESGO accredited center now, you have the ESGO accreditation, and then train 5 or 6 OB-GYN, and then they will be qualified. Stop us from working after that.
No, and then, I'm sorry, very quickly, I'm just going to finish. Peer review, M&M, very important. If you're going to give you clinical privilege, you have to have peer review, morbidity and mortality. And the last thing is accountability, المساءلة. All this, إذا عملت الحاجات دي كلها، سمعة الدكاترة في مصر هتعلى أعلى من هتبقى قوية أكتر. وكويكلي برضه الفellowship مش بس السيرجيكال بارت، لازم يفهم بيولوجي اوف كانسر ويعمل ريسيرش، يعني فellowship مش بس سيرجيكال.
دكتور جمال اتفضل. دكتور جمال وبعدين دكتور سلامه وبعدين دكتور رضا. تمام.
I'm Dr. Gamal Amira, former head of surgical department NCI, and
The role of the international society, please, if you mention it.
and member of the UICC, representing Egypt in the UICC. We have actually started the specialities in the NCI 9 years ago when I was the head of the department, and we established 7 specialities. One of them is the gynaecological oncology. We started in 1914, and Professor Sipitori was attending with us, and we had made a multidisciplinary team, including pathology, radiology, diagnosis and radiotherapy, etc. And we do about 700 cases of gynecologic cancer in the unit every year, maybe now more. And we have trained a lot of Egyptian doctors from many universities and from other countries like Iraq, Saudi Arabia, Sudan. And I congratulate Basil for his efforts and for the meetings he makes every week, and I attended some in the beginning, but I have many other responsibilities. We have agreed upon to make the diploma with Nasser Institute, which received about 1,000 cases of gynecologic cancer, and with the National Cancer Institute and with Mansoura. We have actually in the NCI got the approval of the head of Council of Universities to have diplomas in the 7 specialties, gynecology, GIT, urology, head and neck, etc. And this will be another type of study. It will be a benchmark for us.
دكتور سلامه
I am a professor of gynecology in Minufia University and a board member of Egyptian Medical Syndicate. The main problem of the talk of Basim, it is dark for the future. He is a big criticizing man. Why? Because as we know, education has 3 pillars, or any science. Number 1, knowledge. Number 2, skills. Number 3, you have to change the behavior. Basim and his colleague and like others start, but at certain time, as he said in the talk, Egypt and the idea and go away. Basim, really, يعني its talk is alarming. Why? And very nice and optimizing. Why? Because the cost is really very low. But the doctors, but there is no system to go through. It is a limited group behavior and interest, and at the same time, in Egypt, we have to follow the system. As Professor Gamal said, we have a system, MOH system, Egyptian Medical Syndicate system, and then go abroad to approve. You come with barajot from outside, but not start from the base here in Egypt. Anyhow, I am appreciating your work, and I back you for any logistic registration here in Egypt. Thank you.
رضا عبد الهادي, member of Mansoura unit obstetric gynecology department. I would like to thank Basil for his good effort. He is actually my dear friend. I want to highlight very important point. Gynae-oncology service is not only a surgery, is not a management, is not a chemotherapy and radiotherapy. It is a whole story. You take the patient from zero, from her village, from screening, from prevention. You have trophoblastic tumor, you have vaccination, you have diagnosis, you have treatment of pre-invasive lesion, you have diagnosis. You will be surprised when you have some of your cases of cancer cervix inserted IUD device 1 week before. So where is the gynecologist? Why he didn't see this case? So I want to say, so gynae-oncology service is a whole service including about 6 points. Treatment is the last point that Basil work and his friend and for chemotherapy, radiotherapy, MDT, surgery. This is the 6 point of management. But you have, where's all the story? So to improve the outcome of gynae-oncology cancer, we performed a well-structured gynae-oncology unit in Mansoura and also in Asyut, in Banha, Dumyat, Alexandria. This is gynae-oncology unit in the Department of Obstetrics and Gynecology, who performs the whole task, the whole story, who takes the patient while she is still girl. And this, we are producing our work, we are producing our national project of screening, we are improving our work, we are working according to the national standard, the international standard. We also structured a gynae-oncology diploma to give a certified diploma from gynae-oncology unit, obstetric and gynecology department, to be certified as a gynecologist. I want to, this is مجلس أعلى للجامعات. منصور, yes. And I want to also just to reply to Basil that I appreciate Professor Secretary is one of the eminent gynaecologists. Also Professor Saeed, he is the head of our unit. He is also trained 7 years in Manchester for gynaecology. Me also, I have PhD for Erasmus. I have 7 years to finish this PhD. Some of the training was in Erasmus, and some was in Mansoura, and also in Urology Center of Mansoura. I also, Erasmus approved my training as a gynecologist before granting me the degree. So in our unit only we have two certified gynecologists from European universities. So again, Basil and his friends, his colleagues, and all oncology centers in Egypt are very appreciated. They do a good service. They have a good facilities. Our government and the people give them a lot of money to help the patient with cancer. And we all appreciate this, and this is a good point. So they have work, they have to serve people. This is don't lose this strong point. But also, again, I'm sorry for my colleagues, we're back to the original gynae-oncology subspecialty is the 4th specialty of gynae-obstetric as the world and the Egypt say. Thank you very much.
لاست كومنت يا احمد بعد اذنك عشان وقت الصلاه. انا شكرا دكتور رضا. انا اسمي محمد حجازي بروفيسور اوف سيرجيكال انكولوجي منصوره يونيفرستي.
You're the head of the Mansoura?
I'm the director of Mansoura University Hospitals. Yeah, I'm the executive director. But it is something else. I'm speaking now as a surgical oncologist. I think it is a major insult for the work of others to turn it into a battle between surgical oncology and gynecology. I don't think this is allowed anymore. Your work is highly appreciated. Rida and his colleagues and Adil work is highly appreciated. Let me speak about the challenges we are facing in the field of surgical oncology. Do you know that there is a global crisis in the number of surgical oncologists 10 years from now? We are going to be reduced to half when most of us are retired. No coming generations to cover this. Number of physicians, surgical oncologists covering patients will be reduced to half. If I am responsible as a surgical oncologist for 1,000 people, I will be responsible for 10,000 people. Every piece of work and collaboration between surgical oncology and other specialties should be highly inaugurated, not stopped by any personal bias or something. I think this is not allowed. It is a global crisis. Second, the first specialty that should implement the MDT concept is surgical oncology. There is no other specialty in science that should adopt and implement and train others and themselves about MDT, collaboration, collaboration, collaboration. Your work, Dr. Adil, Dr. Rila, is highly appreciated. Your work, Basil, is highly appreciated. And we are going to work together. And finally, the patient is going to benefit. Thank you for your effort.
Okay, I mean, I heard some excellent comments from a lot of people here. Clearly, this is an important topic of debate. I accept that some of the difficulties with change is often territorially based. Some of it also is academic in terms of who's got qualifications and are the qualifications legitimate. I think we just heard from a manager about running a service. You have to run the service. You have to plan for the service in the future. The only way that any manager or service can survive the workload is to be inclusive. And to be inclusive requires commitment, not just in terms of qualification, but how much time your job plan, your working week, you dedicate to that particular role. And when it comes to qualification, it's more about expertise. You recognize expertise much more easily than a qualification. I recognize expertise much more easily than a qualification. And I expect expertise not just in surgery, but also in chemotherapy, radiotherapy, radiology, pathology, all of that team that you described, I expect expertise from. Correct. Correct. We have to work together. Yeah. We have to work together. Don't try to put any one complaint. Just either cooperate or leave him working. Yeah. So I'm very encouraged with everything I heard today, and Amit's asked me to close this session down. We meet at 2 downstairs in the Tutankhamun room. Thank you.